As India continues to fight the pandemic and our vaccination drive is underway to protect the citizens from the deadly infection, Kerala, a state currently contributing 60% of the active cases in the country, has a new concern. The recent outbreak of the Nipah virus in the state has already claimed one life. Before we dig more into it, let me tell you about this virus. The Nipah virus is a zoonotic virus, which means it spreads from animals to humans. These animals could be pigs or fruit bats. This virus is far deadlier than COVID-19. Though it spreads at a comparatively slower pace, the virus had a mortality rate of 68% back in 2001. Later in 2007, it rose to 100%, where all 5 of the infected persons died. This is not to create panic, but the virus has no defined treatment so far, which makes it even scarier. Now here's what the Centers for Disease Control and Prevention suggests as preventive measures. Washing hands regularly with soap and water, avoiding consumption of raw dates or fruits that may be contaminated by bats, avoiding coming near to stray animals and persons with the infection. You must follow these steps along with the ongoing COVID protocols of social distancing and wearing masks. But here's something tricky. One infected with the Nipah virus can show similar symptoms to COVID-19 infection. Cough, sore throat, dizziness, drowsiness, muscle pain, tiredness and headache, stiff neck, mental confusion, seizures, and sensitivity to light are some common symptoms. Kerala Health Minister Veena George said there is nothing to worry about and the health department is closely following up on the situation. She also asked the authorities to run door-to-door surveys in the containment zones. Over 250 people are quarantined so far, out of which 11 show Nipah virus symptoms. A special team from Pune has set up a special laboratory at the Medical College Hospital where these samples of the infection would be tested. The Kerala Health Department has been on high alert since the first death was reported. In view of this, the Karnataka government has issued an advisory asking the districts bordering Kerala to be extra vigilant. The state is now monitoring people arriving from Kerala for symptoms of the infection. The Karnataka government has also asked district authorities to develop a systematic surveillance system to identify clusters of encephalitis cases for the early detection of Nipah outbreak. If you're watching this from any of the southern states of India, stay alert, make sure to follow the preventive guidelines.